In this lecture, you'll learn about the parts of the ear and disorders of the ear. The ear has several parts that include the external ear, the eardrum, the middle ear, and the cochlea. We'll take a look at each of those. There are several divisions of the ear. There's the external ear, which is the pinna and the external auditory canal. There's the tympanic membrane, which is the eardrum, and it divides the external and middle ear. There's the middle ear, which contains the ossicles, the hammer, anvil, and stirrups, and the eustachian tube, and the inner ear, which consists of the cochlea, vestibule, and semicircular canals. This is the first model of the ear you'll see. It's important that you know these parts. Number 1 is the semicircular canal. Number 2 is the cochlear nerve. Number 3 is the pinna or auricle. Number 4 is the cochlea. Number 5 is the auditory or eustachian tube. Number 6 is the temporal bone. Number 7 is the tympanic membrane, also known as the eardrum. Number 8 is the external auditory canal. Number 9 is the lobe of the pinna. And number 10 is the helix of the pinna. Here is the same model. See if you can label the parts. Here we're going to focus on the parts of the middle and inner ear. In this model, number 1 is the vestibule. Number 2, the semicircular canal. Number 3, the tympanic membrane. Number 4, the incus or anvil. Number 5, the malleus or hammer. Number 6 is the cochlea. Number 7 is the ampulla of the semicircular canals. And number 8 is the stapes or stirrup. Can you identify the parts of the previous model without using the labeled diagram? Here is another model showing the close-up of the middle and inner ear. Number 1 is the vestibule. Number 2, the semicircular canal. Number 3, the tympanic membrane. Number 4, the incus or anvil. Number 5, the malleus or hammer. Number 6, the cochlea. Number 7, the ampulla of the semicircular canals. And number 8 is the stapes or stirrup. Again, can you label the parts without looking at the previous diagram? The ear bone, also known as the auditory ossicle, includes 3 tiny bones in the middle ear. They are the malleus, or the hammer, the incus, the anvil, and the stapes, the stirrup. Compare these 3 bones to this dime, and it will give you an idea of how small they are. This shows you where the 3 tiny bones lie relative to the other parts of the ear. Here's a simple explanation of how the ear works. Sound waves enter the ear canal and make the eardrum vibrate. This action moves the tiny chain of bones, the ossicles, remember those are the hammer, anvil, and stirrups, in the middle ear. The last bone in this chain knocks on the membrane window of the cochlea and makes the fluid in the cochlea move. The fluid movement then triggers a response in the hearing nerve. We're going to talk briefly about 3 conditions of the ear: hearing loss, cochlear implants, and otitis media. Hearing loss or impairment is either a partial or a total inability to hear. Hearing loss can be caused by a number of factors, including genetics, aging, exposure to noise, some infections, birth complications, trauma to the ear, and certain medications or toxins. Hearing loss is often accompanied by tinnitus, which is also known as a ringing in the ears. A buildup of earwax, medication, exposure to loud sounds, and hearing loss can all cause tinnitus. The ringing might be constant or occasional, but it's often the first sign of hearing loss. Depending on what led to the hearing loss, treatments might be removing wax blockage. Earwax blockage is a reversible cause of hearing loss. Surgical procedures, some types of hearing loss can be treated with surgery, including abnormalities of the eardrum or the bones of hearing, also known as the ossicles, hearing aids, and cochlear implants. You can see a cochlear implant in the image to the right. Cochlear implant is a small electronic device that electrically stimulates the cochlear nerve, which is your nerve for hearing. The implant has both external and internal parts. The external part sits behind the ear. It picks up sounds with a microphone. It then processes the sound and transmits it to the internal part of the implant. Acute otitis media is an infection in the middle ear. That's the air-filled space behind the eardrum that contains the tiny vibrating bones of the ear. Children are more likely than adults to get ear infections. Because ear infections often clear up on their own, treatment may begin with managing the pain and monitoring the problem. Sometimes antibiotics are used to clear the infection. Some people are prone to having multiple ear infections, and this can cause hearing problems and other serious complications. Symptoms of otitis media can vary between children and adults. Symptoms in children include ear pain, especially when they're lying down, tugging or pulling at an ear, having trouble sleeping, crying more than usual, trouble hearing or responding to sounds, a loss of balance, a fever of 100 degrees Fahrenheit or higher, drainage of fluid from the ear, and headaches. In adults, the primary symptoms are ear pain, drainage of fluid from the ear, and trouble hearing. So how do you know when it's time to see the doctor? If symptoms last for more than a day, if they're present in a child less than 6 months of age, if the ear pain is severe, if your infant or toddler is sleepless or irritable after a cold or other upper respiratory infection, if you observe a discharge of fluid, pus, or body fluid from the ear.